All right, Marie, would you like us to start?
Yes, please.
All right, we'll get into it. Let me just share my screen. All right, is everyone seeing my slides and not my notes? All right, perfect. Well, welcome everyone. I'm so glad that you're here with us today. It's going to be a great one for sure. My name is Christine Tucker. I'm the Health Equity Manager at Healthy Birthday. Healthy Birthday is the nonprofit that started the Count the Kicks program, which is an evidence-based stillbirth prevention program. And I'll let Dr. Joy introduce herself.
Good evening, everyone. My name is Dr. Joy Baker. I am a practicing OBGYN physician in LaGrange, Georgia at Wellstar West Georgia Medical Center, and currently serve as the Quality and Safety Director for Women's Health and the chair of the department. And I'm very excited to be with you all this evening.
Yes, we are so grateful to have Dr. Joy with us today to share more from her medical lens. And I'm coming kind of from a public health background. And so, we're going to be sharing about stillbirth prevention today, about Black maternal health today. And so just have that as kind of a content warning of sorts. Also I'll give context that a lot of these studies that we will be referencing, like specifically worked with different demographics. So we might use like gendered language in those cases, but I might also use a lot of gender neutral language because anyone, any birthing parent is welcome to use Count the Kicks tools. So with all of those things aside, I want to jump into what the problem is that we're facing and what we're trying to address here. So we have a public health crisis. stillbirth is affecting 21,000 families a year. And we know that it is very prevalent. And what we would love to see is programs like Count the Kicks becoming as prevalent as things like the Back to Sleep campaign, which has reduced the rate of SIDS by like 60% since the 1990s. Imagine how many safer deliveries we could have if programs like Count the Kicks were as well implemented. So we're going to get into some of the data. So before going too much further, I want to talk about stillbirth in numbers and what the data shows us. So when we look at this graph, you can see that stillbirth is not experienced the same way when it comes to racial groups. So in the United States, Black and Native Hawaiian and Pacific Islanders are much more likely to experience stillbirth, and Indigenous families are also at higher risk. And so we know that we're losing about 60 babies a day to stillbirth in the United States. So we know that we really need to focus on working within these communities and finding ways that we can partner and uplift different initiatives that are actively working to improve their quality of life and their birth outcomes, not just with Count the Kicks, but with kind of it's almost like a group project. We all have to work together to make this better. Because this is a national audience, I want to show you a visual depiction of where your state falls. So I would love for anyone who's watching to drop in the chat where you're tuning in from and kind of what your work background is, what kind of role that you have. And if where you're at on this map surprises you. So if you're seeing the darker red, that's going to be where stillbirth prevalence is higher and the lighter colors are lighter. Let's see. Make sure. All right, let's see. Philadelphia, near a doula. Yes, we love doulas in this room. Neonatologist in New York, not surprised. Yes, New York is a tricky area. We just got partnered in New York, so we're really looking forward to doing some work there. Washington State, yes, we are recently partnered there as well, and there's definitely some work to do in Washington. Indiana, not surprised at all. New nurse grad next month, doula in the making. I love it. Yes. I'm huge fans of Indiana. I just had a presentation with the Indiana Minority Health Coalition earlier this week. So lots of great work. Connecticut, yes. Illinois, yes. All places that are seeing the effects of this public health issue. All right. So as mentioned on the previous slide, there's a large divide when it comes to those who are experiencing stillbirth. And I know that this is a Black Maternal Health Week kind of featured webinar, so I won't go too deep into this because I know the people tuning in are probably kind of attuned to the issues that we're seeing. But some of the things that play into stillbirth specifically can include, of course, systemic racism, or the way that society is fostering this racial discrimination through those mutually reinforcing systems of things like housing, education, employment, media perception, and all of that plays into how you're treated when you go into the hospital with concerns. Epigenetics, or the way that your environment and your experiences influence your health and your gene expression. Pre-existing conditions. If you have things like diabetes or high blood pressure, those things can cause more risk. And a lot of that is influenced by the chronic stress that Black and Brown people experience in the United States. Socioeconomic barriers, of course, we know that there are a lot of financial and other kind of life barriers to just accessing medical care. And one thing that doesn't factor into this is education. So you can't success your way out of having negative birth outcomes. It's not possible. We know so many people, revered doctors, athletes, people who have the highest education possible who are still affected by this, because it only takes one person on a birth team or one kind of barrier to being able to access care that can lead to maternal mortality, morbidity, stillbirths, all of these negative birth outcomes. So we're doing a lot to address this. We have a lot of projects going on. I'll just talk about them briefly. One of the biggest ones is language inclusion. And I think it's really important to note that like we're not just using Google Translate for these languages that we have available on our app and in all of our paper materials and things that we're using to educate parents. We work intentionally with language translation companies that look at things like cultural norms, linguistic differences, and testing in populations to make sure it's correct before it reaches the parents that we're serving, which isn't always the case. We make sure, we're representing diverse populations in our web presence and educational materials. We have a health equity focus. So as a health equity manager, I kind of get to be in the middle of every single project that Count the Kicks has, because all of it kind of focuses on making sure that what we're doing is impacting the communities that need this information the most. We also do a lot of community outreach. So we are out everywhere. We have ambassadors, 60 ambassadors scattered around the country who are able to share this information with people. We go to all sorts of parent, pregnant related events, but also to conferences like, AmChimp. We just had people out at AmChimp and other kind of provider related conferences to make sure like every level of people that are interacting with pregnant people are learning about this. I'll be at a giant pregnancy event on Saturdays. So we make sure that we're listening to our community, we're taking their feedback, we have consistent surveying and focus groups to just make sure that everything's working and everything's constantly being improved to continue moving things forward. So I'm going to share a video real quick that's going to paint more of a picture of what we're doing to work within communities that are disproportionately affected by stillbirth, and it includes some impact stories from families who are using our program tools. You hear that all right?
I am so blessed that she got here safely. And I'm so glad I listened to myself this time and I listened to my body and I counted my baby kicks. Count the kicks just, I mean, it helped. It really did. It saved my baby's life. It really did.
She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, what if, what if, what if?
Right. I love Destiny and Sonara's stories. And, we have so many families that have been impacted by this program. So before I get into how you can share information about Count the Kicks that can help your patients, I want to make sure that you know kind of some of the research behind what we're doing and why we're invested in this and why we chose to go in this direction. So there is research that shows how a change in fetal movement can shows an increased risk of stillbirth, and that it should be one of those warning signs that should be educated upon. We also have a lot of research around how it's not going to increase hospital utilization, which is important, right? Because we don't want to send like droves of pregnant people to the hospital worrying. And that's something that we're very careful about. A recent meta-analysis looked at 18 studies and found that encouraging awareness of fetal movement is associated with reduced adverse neonatal outcomes without an increase in interventions in labor. And also, it has lowered it hasn't lowered, but we haven't seen any increases in the C-section rate in Iowa in response to Count the Kicks, which is something like we're very happy. Very happy with. We don't want to create more problems, of course. And some people also might be worried about Count the Kicks causing more of a anxious response in parents, like they can't handle the information. But we feel like that's a little bit infantilizing because we actually did some research and found that people feel these feelings of bonding when they're checking on their baby every day. And when they're counting their kicks, the movement, all of those things. And they actually felt less anxious because they had the data back up to go with their intuition. And I think that we do a lot of educating on topics like listeria, like toxoplasmosis, CMV, all of these things that can affect pregnancy in clinics, but we're not always talking about stillbirth because it's one of the scariest outcomes, but it's one of those outcomes that comes from all of those other things. And so we really want to give the parents the knowledge and trust that they can handle that because not having the information and having it happen to them is a lot worse than being a little nervous. All right, Dr. Joy.
Okay. So I think that the evidence is pretty clear, and you can scan these QR codes to be able to look at some of these. The British Journal and the American Journals of OBGYN have shown that folks who are able to measure their fetal movements can have better birth outcomes. Every time I get an audience to talk about this, I always talk about, as an obstetrician, the worst thing is when I have a patient that says, I haven't felt my baby move since yesterday. And then they come in and we're unable to find a heartbeat for that baby. And so actually being vigilant about fetal movements can make the difference for that family. And so I highly recommend, if you're interested in learning more about the research, to do the research, but I'm more excited for you to learn more about how to access these resources for yourselves or for pregnant people that you know, or for your community at large.
Absolutely. Yes. And what was great about this is that they used Iowa as like the kind of experiment and the surrounding states as a control. And I think that's kind of a cool scientific way of looking at it. What states weren't doing stillbirth prevention programs, which one was, and how did it compare? And when we did all of that, we saw this great outcome. So you can see here the national data is up on top. There's that red line, and below is the trend line of Count the Kicks being active in Iowa starting in 2008. And we saw a consistent 1% decline every 3 months in that time, with the exception of a little syphilis spike. It's always syphilis causing the stillbirths. We are still really focused on doing a lot of education around that in response to that as a contributing factor to stillbirth rates across the United States. But also, another great win of this program was we were able to lower the African American stillbirth rate in Iowa by 39% in just the first 5 years. So we know that this can work. We're just trying to share it with as many people as possible so that we can get it implemented in all other states to bring more people healthier deliveries. And one interesting thing about this as well is that the rate of smoking and other kind of things that increase your risk for stillbirth in Iowa, like other substance uses, were going up at this time, but the stillbirth rate continued to decline. So that was really encouraging. So one of the projects that we put together was this white paper that shared a lot of the lived experiences of people who had complications in their pregnancies that contributed to having problems, and they were actually using Count the Kicks and were able to prevent a stillbirth, but also prevent complications in their own health. So some of those included genetic conditions that they didn't know about, hemorrhaging, preterm labor, preeclampsia. So there are a lot of benefits to movement monitoring beyond just stillbirth prevention. So we know that 15% of maternal deaths are happening within days of delivery after a stillbirth. And we've heard stories about women having sepsis and those kind of complications after having a stillbirth, but also, you're 4 times more likely to experience maternal morbidity if you have a stillbirth. And that's, that could be pretty severe outcomes, things like strokes. And so we want to make sure that people know that this isn't something that can just benefit their child, but it can also benefit their own health. And a lot of things in when it comes to pregnancy health can kind of go under the radar. You might not notice that you have high blood pressure, but if that baby slows down, that could give you a warning sign. All right, so I'm going to get more into like how this actually works and how you can share it with your patients. So we're a highly effective evidence-based stillbirth prevention campaign. We have this early warning system, and we know that it's working because we received over 130 stories from 36 states across the country and 6 countries outside of the United States, which have all had stories about severe medical complications that came up that were able to be addressed because they were keeping track of their baby's movements and using one of our tools. Our most recent story actually just came in from Brazil. So that brought us up to 6 countries instead of 5, which is really exciting because the power of social media is real. So when we're talking about the conversation you can have with your patients, we know that it's recommended for you to start counting between 26 to 28 weeks. So that's when there is a consistent movement pattern established. And what counts as a movement can be rolls, kicks, jabs, swishes, pushes, really anything except for hiccups, because those are involuntary movements and those do not necessarily count because the baby isn't trying to move, they're just hiccuping. And counting every day might sound like a lot of work to some parents, so we made a tool to make this as easy as possible. So the Count the Kicks app is completely free. It has no pop-ups, no ads. It's very simple to use. It's just a kick counter, and it is available in 21 languages that are, tried and true. And this is a very well-used app. We've gotten all these stories submitted to us because it's been downloaded over 200,000 times in 140 countries. And what we'd really like for medical providers to educate their clients on is that they want their patients to start counting their baby's movements in that 3rd trimester. Take time every day to sit down with their baby, feel that movement just once a day when that baby is normally active. And then they just tap that little foot every time they feel one of those movements, whether it be a kick or a push. And then when they get the 10 movements, they're getting this visual feedback. So you can see on this graph here, it's looking pretty flat, and that's what we want to see. We want to see a consistent movement pattern. We want people to know their baby's normal for when they get to 10 movements. And if we're seeing the big spikes on that graph, that's when we know, oh, like something's irregular here. And this is a great tool because they can back up their intuition. They can share this data with their doctor and say, hey, this isn't like my baby. This is weird. Can we get it checked? And there's a lot of great features. You can set a reminder to be able to count every day. You can count for singles or twins. And there's a lot of features built in. And we also know that people might want to count different ways. So we have a web-based kick counter for people who can't have their phone out or don't care to. And also paper charts. And we have wristbands for counting as well. Lots of different options. Another great feature built into the app is the Find Help feature. We know a lot that goes into birth outcomes is social determinants of health, and Find Help can help parents find free resources and support before their birth, which we hope will contribute to less socioeconomic stress and also make an impact on the amount of adverse childhood experiences that are happening. We have social determinants of health surveys built into some of our state programming and some of our apps. So sometimes in certain states, they'll get questions that pop up asking about specific resource needs and then get pointed towards specific resources in the state that we're partnered in. So that happens in states like Iowa and Indiana and a couple of others as well. So much of the traction that Count the Kicks has built has come from having easy to understand educational tools, including posters, brochures, app download reminder cards, all sorts of things. And really, we want to make this, bright and cheerful, not doom and gloom, and more about empowerment and education. We have these available for free in 27 states and several more in the works for later this year and for low cost everywhere else. Our original materials on the left are in all of our partner states in English and Spanish, and many states choose to implement additional languages like Portuguese, Haitian Creole, Navajo, Swahili. And the materials on the right are at-a-glance materials, which are more condensed, simple, accessible messaging for parents that might be more on the go. And these are something that's very easy to hang up in an office and just have available so someone can scan the QR code, download the app, learn about the information. All right. Dr. Joy?
So when we talk about fetal monitoring, one of the things that we should consider is what happens in outpatient offices and also in the hospital. And so there are some standard ways to, I guess, for medical professionals to talk to each other about fetal monitoring. One of my great interests is electronic fetal monitoring, and we talk about that. And so in any patient who is experiencing decreased fetal movements, the first thing that they want to do is be able to access their local office or hospital so that they can get some fetal monitoring done. And the way that we do that is with an ultrasound electrode that goes on the belly. And then there's also another monitor that goes on the belly called a tachometer that looks for contractions. So when someone comes in and shows the data that they've collected on their Count the Kicks app, that I know, yeah, there is something irregular about baby's movements over the last day or two. Why don't we get what's called a non-stress test? And so we'd hook them up to these monitors, and we usually keep them on there for about 15 to 20 minutes and just get an overall picture of what the baby's heart rate is doing. That helps us to ascertain how baby is doing. There are some markers on that fetal heart rate tracing that kind of tell us, yes, this is reassuring versus, no, this baby doesn't look so hot. I'll give you an example. A couple weekends ago, I was working on call and a mom came in and said, hey, I have not really been feeling my baby move the way that I normally do. And we put her on the monitor, and the tracing wasn't really reassuring at all. And then we got an ultrasound, and it turns out this baby was only doing 1 out of 4 of the things that we expect for babies to do. And so that means that this baby was really in distress. And so we were able to get her safely delivered. And the baby needed some additional assistance in the NICU, but is alive and well today. And so this really makes a big difference. And so anytime that a pregnant person reports decreased fetal movement, we should all be aware that there is standardization about what should be done when you contact your OB or midwife, or you go to your local hospital. There should be a non-stress test. And in some cases, there should also be an ultrasound that's called a biophysical profile. And that looks at 4 key indicators of fetal well-being. And we can actually give your baby a test score. So just important to know that, because I have had patients who have told me, well, I went to the ER and they just put on the fetal Doppler for like 10 seconds and told me I was fine and go home. So it is really important to know what happens if you do get abnormal movements and what you should expect once you contact your healthcare provider.
Yes, that is great. Great feedback, Dr. Joy. We had a question in the chat. It says, have you seen any disparities among Black babies and white babies with fetal monitoring? Do Black babies tend to be lower? I'm not sure if they're saying, do Black babies tend to like move less? I don't believe so, but I will let
No,
you
they
chime
should,
in.
yeah, that should certainly, again, I tell people all the time because believe it or not, I even tell nurses this sometimes. Race is a social construct. There's nothing biologically wrong with Black people that ending racism can't fix. So let's just,
Yes.
say that out. But no, you should have activity should be normal. Now, depending on the position of the baby, you may feel movements better at sometimes. And then depending on, how far along you are, you may feel differences in movements. And that's one of the key pieces is that starting in the third trimester, where a movement pattern should have already been established, is much better than say starting at 22 weeks because the baby is still so small, you may not feel those kicks and punches and rolls if it's in a particular position. But once you hit third trimester, the baby is large enough to where you should feel the elbows hitting the side of the uterus or the kick that hits the top of the uterus. You should be able to feel those movements pretty consistently. And so all babies should move about the same.
Yes. And then another question in the chat, at how many weeks should stress tests begin? So I feel like that's kind of very dependent on if a whole lot of things, if people end up getting stress tests, non-stress tests.
Well, the literature really, so once you have reached fetal viability, now there's a lot of different ideas about when fetal viability actually happens. In most places, it's going to be probably 22 to 24 weeks. So if are a person who, you have a higher risk pregnancy, let's say you have diabetes, hypertension, severe obesity, like if you know that you're already someone who's at risk for stillbirth, that would be a reason why we might consider starting non-stress tests earlier, like at the 22-week mark. But the generally accepted data is around 24 weeks that each person should get a non-stress test prior to going home. So if you come to our hospital to the ER and maybe you came because you stubbed your toe and you're 28 weeks, you're still getting a non-stress test, because we have two patients at that point, right? We have both mom and baby, and we have to assess the well-being of both.
Absolutely. That's a great answer. All right. And I saw more thing. All right. And then I did see one piece of feedback. I wonder if the question is, have you seen data that shows if a Black mom presents, she is sent home, but a white mom receives the testing? And, anecdotally, I believe that does happen quite a lot. But I'll let Joy chime in on that one too.
So unfortunately, we have, and we have seen consistent data, especially qualitative data. Qualitative data is the stories that people tell us. That is still data, and it is very compelling data. But the stories that we hear, like, oh, my concern was completely dismissed, I was sent home, or maybe I called in to speak with the nurse on duty, and I was told not to come. I've heard that a lot, like, oh, you'll be fine, don't worry about it, eat something sweet, or drink a soda and the baby will move fine. That sort of thing certainly does happen, and unfortunately sometimes that happens more often to folks who are Black, brown, or under-resourced or considered poor, you know. So I think that's something that we have to reckon with. And that's why it's so important to have this information in the hands of the people, and for people to be able to come in and say, have the right language to use when they call or come in and say, hey, my fetal movements are decreased. I would like to have fetal monitoring, please,
Yes, absolutely. I fully agree. And I even in our home state where we're definitely the most implemented here in Iowa, I still hear stories all the time from especially Black and brown people who go into the hospital and have their care delayed. They're waiting for an hour or 2 hours to get seen, and sometimes that can cause some really negative effects on their baby or their own health. And that all of that goes up once you do have those other things playing in, like Dr. Joy said, like, language barriers, especially, they're um, so caught up in trying to find the perfect translator, and just instead of just calling a language line to get quick, adequate care for someone, and things get delayed and negative outcomes happen. So it's funny, one of my coworkers actually just had her baby like a week ago, and she called in to her provider and said, I'm having reduced movement. I would like to come in. And they were like, oh, just drink some juice. You'll be fine. And she was like, you are messing with the wrong one. I I work for Count the Kicks. You just failed the test, the very real life test. So, yes, it happens a lot that people are dismissed. And this is why we want to encourage both parents to go in when they have concerns, but also providers to welcome those people with open arms. Like, yes, please let me check you out immediately and make sure everything's okay. All right. And then And then we do have a video here of a doctor, or not doctor, of Rose Horton. She's a great, amazing nurse. And she's kind of explaining the need for more consistent implementation of programs that improve birth outcomes in this video.
My name is Rose Horton.
Let's see. Oh, she did. I don't know why these are so quiet. I'm sorry.
Director of Women and Infant Services. I coined the hashtag Not on My Watch in 2017 because of my rising frustration with our rising maternal morbidity and mortality rate. It was a call to action for all nurses. I wanted all nurses to rally with me to ensure that we're providing evidence-based care, that we are listening to our patients, that we are amplifying their voices, that we are including them in shared decision making. We also have an increasing rate of stillbirths, with a third of those as preventable. Not on my watch. I don't want any of that to happen. As we celebrate Black Maternal Health Week, the week of April 11th through 17th, please join me in saying not on my watch. Thank you.
All right. I think it's such a good call to action and such a reminder that, like, you can take, something as simple as a hashtag, and many voices can contribute to better outcomes, because when we're speaking together, when we're having conversation, when we're holding each other accountable, we can see that measurable change. So one of the things that I love is that we're not the only ones that are doing this work. The CDC here, her campaign lists lack of fetal movement as an urgent maternal warning sign. And so it does the AIM bundles and the A1 urgent maternal warning signs as well. So we know that this is kind of becoming a little bit more commonly understood as something that patients should be paying attention to. One of the updates that we're most excited about is that the Association of Women's Health Obstetric and Neonatal Nurses has recently released a practice brief addressing decreased fetal movement. And it's kind of a great milestone for us because it's some of that systemic work that we've been working on. They're one of the largest organizations of nurses in the United States and beyond, really. And so what this does is they've released this practice brief, and they're also going to do a pilot. And at the end of that pilot, there will be a standard of care released that kind of guides providers in what they should do when someone presents with decreased fetal movement based on the literature that's available, because there are some hospitals that have really great standards for what they do, but there are some that don't. And what we were running into is we were saying, go to the hospital if you're noticing a change in your movement. And we were actually getting calls from some hospitals that were like, well, what should we do? And we were like, that is not our scope. So we partnered with all of these nurses and doctors to figure out what the scope is, what is the best practice. And so this was a great step in the right direction. And you can see here that kind of the language that's used in it aligns with all of the things that we're doing at Count the Kicks, all the things that we're educating on, like. And what'll be cool about this, about the practice brief they put out, about the protocol that they'll put out when everything is said and done, is that it'll have like if when, kind of like a flow chart. So if you present to, you know, a regular birthing hospital, this is what you do. But if you're in a rural hospital without the resources to deliver a baby in a conventional way, like these are the kind of things that you could do. So it kind of will solve for several of the things that people are presenting with. So I think that'll be great. All right. All right. I'll let Dr. Joy hop in and share kind of how some of the things that we share with patients, and also how you can implement this in your practice as well.
So this is not difficult to implement at all. So what we really want to do is to standardize. And so as a quality safety leader, I love standardization. Our goal at my health system is every woman, every time. That's what we always say, is that everybody gets a standard treatment. So giving instructions to each patient, giving information to each patient so that they're able to access the resources that are available. We love Count the Kicks in my office because it's so easy for the patients to get and do. And then, kind of explaining to each patient when to start counting. And like I said, the third trimester is when we think movement patterns are pretty well established. And then how long does it take to get to 10 movements? When I was in training, rather, before I started my practice, we were always taught it has to be 10 movements within 2 hours. That is not exactly what has been borne out in the literature. What actually has been borne out in the literature is that you should take about the same amount of time to get 10 movements. So most people should have babies that are fairly active. And I'll tell my patients all the time, you'll probably get 10 movements around 10 to 15 minutes. Like it shouldn't take you 2 hours to get 10 movements. And so by tracking how much your baby is moving at that particular time period during the day. So say if you come home from work and it's 5 o'clock and you sit down and you're like, okay, now it's time for me to focus on baby's movement while dinner's cooking. And I'm going to tap my app every time that I feel a movement and then see how long it took me to get that. So the next day when you come home at 5 p.m. and you put your dinner in the oven, you sit down on the couch, you should be able to count your baby's movements, 10 movements within about the same amount of time. So what we're looking for is changes in those movements. We're looking to see, like, is it taking you much longer each day to get those movements? And that might be, the kicks, the jabs, the rolls, especially as the baby gets larger. I tell my patients all the time is that, the baby's not really able to stretch out like this anymore. Babies can only just kind of roll and like turning over in the bed. Feels like the baby's turning over in bed. And so that's something just to be aware of. And like Christine shared, hiccups don't count as movements because they're completely involuntary. Like you don't want to hiccup when you have the hiccups, right? You try to stop, but you can't. So those are movements that are completely involuntary. And so you can't count those. And then, once you've determined the normal movement for your baby, then you become the expert on that movement, right? We only have your body and your baby when you bring them to us. You're the one that has that baby in your belly the entire day and all night. So you know when something is off. So trust your intuition. I love that Count the Kicks app offers you some objective data a graph that you can actually pull out and show to someone and say, hey, my movements are decreased. I've noticed a lot of irregularity. I'd really just like to get some monitoring done for peace of mind. And so one of the big things that we're working on now in our OB emergency department is like the discharge process, because sometimes people come in for various things and we need to be giving them information about counting fetal movements, because like Christine just shared, having decreases in fetal movement can be an early warning sign to something else, like severe preeclampsia or placental abruption, where the placenta is coming off the wall of the uterus prematurely. So you want to be able to educate people about that at every opportunity. So at every office visit, if they come to the hospital for some reason, paying attention to those things. And this requires training for the team. So all of your medical assistants and nurses and techs and clerks and everyone needs to be on board. So to implement this standard procedure, we really want everyone on board. Everyone should know about fetal movements. And I tell my staff all the time in my office, I said, people know that you work here. They're going to ask you questions, and so having some of the basic knowledge and being able to inform your community is part of your job description. And so we want to print out after visit summaries for all of our patients, and you're able to attach different information at most hospitals and clinics because we, use electronic health records. And so you can actually give that written material. And just kind of looking to see how we can continuously put the word out, make everybody aware of what they should be doing when someone calls or comes in and says they have decreased fetal movements. And then just sort of being very cognizant of how long it takes for you to get help if you need help. Like Christine was sharing earlier, some people wait for a really long time. And so you want to be able to access the help you need. But, one of the things that plagues hospitals all over is that, the average wait time in the ER in the United States is 4.5 hours, which is a really long time. And so while someone is in the waiting room, giving education is also, again, an opportunity for us to have different videos or recordings or things that come up that folks can watch while they wait. And hopefully no one's waiting 4 hours if they feel like their baby's not moving well. But just, as you go to the emergency department, we hear those stories all the time of people waiting for a really long time. And so I thought this was very, very interesting. That 80%, 87% of folks who are using the Count the Kicks app say that they would contact their provider about baby's movements if they were encouraged to by their provider. And so a lot of times I'll find birthing folks are like, I don't want to be annoying, I don't want to be a bother, but I think something's wrong. And so I always tell folks, hey, if you think something's wrong, you need to bring it up. If you feel like something's off, you need to have it checked out, because the very worst thing that can happen is that you or your baby's lives are placed in danger because of your reluctance to speak up. So don't feel like you're bothering us. I think I really believe this. Nobody made me go to medical school. I actually begged for somebody to let me in. Nobody made me choose OBGYN training. I begged for them to let me be one. And so I remind myself at times when I'm like, oh my gosh, I got 55 calls in a night. I remind myself that actually this is an honor and a blessing to do this work. And so now I'm just going to have to deal with this because I'm providing all this education and people are going to have questions and they're going to want to know, well, what do I do if this happens? So we have to have a standard procedure in place. They have to feel like they're encouraged to speak up, and we have to act on the information that they provide when they come in. So I think that that's just very telling that we must be open to accepting folks when they say, hey, I have a problem. We got to be open to. And if people didn't have problems, there'd be no need for me, right? I could just sit on an island somewhere. So that's my job, is to help people when they feel like something is wrong, and to help people stay healthy. So that's my job. So I really always encourage my colleagues to be a little bit more compassionate and understanding, especially when you're, working with moms who are anxious or, feel like something's wrong. We have to respond appropriately to that.
Absolutely. All right. I want to make sure we make it through everything. So I think we can. I know we talked about 10 kicks in 2 hours not being accurate anymore. And then the eating something sugary or drinking something cold. This one's also a big misconception because we're really hoping that people are monitoring their baby and keeping track of whether or not they need interventions. Without things like sugar or juice or cold water, because especially knowing how many places in the United States, it's quite a drive to get to a hospital. Anything more that's delaying care and you're just like laying at home drinking as much orange juice as you can ingest trying to get your baby to move, it could delay needed care. And so we really want patients to just come in and trust those movements right away. And we also talked about Doppler devices a little bit, but they're very popular with parents nowadays, buying them off Amazon, trying to find that heartbeat all by themselves. And I don't want to like infantilize parents at all. Like I'm sure some of them can find their baby's heart rate, but if they're accidentally picking up their own and they think everything's okay, or they just have a faulty Doppler from Amazon, that could cause a lot of problems. Joy agrees. Joy cosigns.
I definitely do agree. I can't tell you how many people run in there with their Dopplers to my office and like, I can't find the baby's heartbeat. And they just don't really know how to use the Doppler correctly or where the baby would be located on their abdomen. So yeah, I absolutely agree. I would not trust myself at home with a Doppler if I'm not, trained to use one.
Absolutely. All right, so I just want to share a couple of ways that you can improve the conversation with patients. Obviously, being equitable, don't assume based on the way someone looks or their background, what they know and what they don't know. Just provide all of the information and, use clear and concise language. That's, something that anyone can understand. Dr. Joy is great at this. And know that, health literacy is not something that people necessarily have a high level of in the United States. And so it's going to take like some very basic information to get this across. And you want to also check for understanding. So using those open-ended questions, making sure that they can kind of summarize what you just said to them afterwards can be ways that you can make sure that they're actually getting the message that they should be counting the kicks and not just handing them a brochure and a very large stack of other documents that they need for their pregnancy and not realizing how important it is. I want to talk about some resources. I love this little baby. Baby's so cute. As we're wrapping up here, here's a QR code in case you would like to have any of these Count the Kicks educational materials. We have all sorts of different ones depending on where you are in the country, but the vast majority of them are completely free, ship free, free 99, and they are just very basic information that can help people learn all about fetal movement monitoring. And we are offering CE credits today, and I'll make sure you have the QR code for that at the end. But I did want to share that we also have a separate training that goes a lot more in depth than this 1 hour available. And you can scan the QR code to learn more about that. And I'll make sure these slides are available to everyone after this. And I just want to talk a little bit more about some next steps that you can take. So I want you to download the Count the Kicks app because why not? It's free. I want you to have that on your phone so you can share it with patients or on an iPad, something where you can get to know what it's like so you can walk people through it, especially if you have patients that speak another language, finding where those settings are, figuring that out so you're not fumbling with it. You can order those Count the Kicks materials that are free or low cost. You can take time to educate and have those kick counting conversations at every touch point when you're meeting with people in the 3rd trimester. So not just at the beginning, but say, hey, how's your baby moving today? How have they been moving? Is it staying pretty, similar to what they usually do? Make sure your entire staff knows about this, not just you, but everyone else. Encourage speaking up. And remember, hours and minutes matter in stillbirth. So especially with those patients that live farther away, make sure they're educated on coming in soon. And I always like ending things on a high note. This is Kai Dalton. He is so cute. He's from Georgia. And Effie's pregnancy was a unique one. She was actually heading into she was having a lot of reproductive health troubles. And so she was actually on her way to pre-op for a hysterectomy when they found Kai Dalton growing in there. And she didn't think she could have another baby. She had had previous losses. And so he was kind of a miracle twice over because of the way that he was conceived, when she was older and they didn't expect her to be able to get pregnant. And also because he was slowing down and she had to push and push and push to get help. Like her non-stress test, her biophysical profile were not coming back well, but they still wanted to send her home. And she had a doula that was on the phone telling her, like, keep pushing. And so she did. And Kai Dalton was delivered safely, but he was very tangled up in his cord. So that was restricting his movement. All right, I want to make sure that everyone's able to access these contact hours for the presentation. So here's the QR code to access those. I'll leave this up for a minute and just look in the chat and see if there's any other questions real quick. How often is this app updated? Very frequently. We are actually going through a big update right now. So we're always adding new languages. We're always kind of doing little bug fixes and things. So pretty much all the time is when it's updated. Let's see, how can this be better implemented in hospitals, clinics, and rural areas in your perfect world? In my perfect world, Count the Kicks will be everywhere. And we go about this in so many different ways. So like in Iowa, every OB clinic that you go into Iowa, Count the Kicks is everywhere. It's in the clinic, it's in the waiting room. It is, there's information on like the mirrors in the bathroom. It's everywhere. And then in populations that are rural, for example, I met a midwife that was like, oh, I love Count the Kicks, but I work with the Amish. So I draw these little charts for them whenever I go to see them. And I'm like, girl, we have printable charts. And she was like, no way. She was so excited. So she was able to just print off a bunch of charts and then go and see her clients that were out in this Amish community. We would love for people to find the things that work for them and share that. We work not just with medical providers, but with doulas, with community-based organizations who can have that in their new client paperwork. We work with home visitors, a lot of home visitors that can go in. A lot of insurance companies have programs where they have like a phone pre-programmed with apps and things. So there's all sorts of different ways. We do billboards, we do bus ads, we are everywhere. And so really we want kind of that Swiss cheese method to be happening. They call it in public health. So if you have one layer of Swiss cheese, there's still some holes, but when you pile them on top of each other and you have multiple layers of people that are sharing this information, it's more likely that it's going to sink in. Let's see, I would love to connect about the work you do in Indiana with IMHC and the role of an ambassador. Awesome. I will make sure I keep your information and reach out. All right, any other questions? Let's see.
Oh, I agree. I see in the chat, someone said I could see this being an excellent project for faith-based organizations. And I absolutely agree. We've taken monitoring systems out to local churches where I live. I live in a small town, and they are very good at connecting with folks and talking to them, and just everybody at church asking the mom, like, how are you doing? How's your blood pressure? How's your baby moving? That is real community care. And so I absolutely agree with that.
Oh yeah, for sure. And we have done a couple of faith-based initiatives in the past, like not necessarily like us doing like the faith part, but we provide specific Kanta Kicks materials. Like we did like bookmarks so people can put those in their like religious book of sorts that have Count the Kicks information on them, and we put those in like the church nursery or the nurseries for a mosque or a synagogue, so that parents are dropping off their kiddos to not cause any trouble during the service, and then they can see the Count the Kicks information. So that is definitely something. And, you know, like people really trust those sources. We know that there's a lot of medical mistrust. So if someone they trust, like someone from their religion or someone who is a close friend, can share this, it can be a lot more impactful. And then, you know, I know we're pretty much done now, but we do have social media, so feel free to check us out. Count the Kicks is all of our parent focus. Healthy Birthday is all of our advocacy, all of our, you know, staff updates, hiring, all of our things that we're doing high level. We also have a lot of legislation that we're trying to advocate for around stillbirth prevention, data collection and things. So, all right. We have to wrap up because there's other stuff happening, but thank you so much for joining. Marie, I'm happy to get you any information that would be helpful to share with them after this. But thank you.